Aspirin. That little white pill that's in pretty much everyone's medicine cabinet. We grab it for a headache without even thinking. But that simple pill, it has a surprisingly complex, two-sided story. So let's get into it.
Yeah, for more than 100 years, this thing has been called a wonder drug. I mean, it's been the go-to for everything from a nagging headache to a fever. It's a true workhorse of modern medicine. And honestly, for very good reason. It works. But, and this is the big question we're going to tackle, is it always so wonderful? See, the FDA actually warns that just grabbing this familiar pill without the right guidance could potentially do more harm than good. So, how do we navigate these two sides of the same coin?
Okay, so first up, let's talk about the good stuff, the side of aspirin we all know and trust. We'll call this part one the lifesaver. This is really where it earned its stripes, especially with its incredible power to help protect against heart attacks and strokes. I mean, its main jobs are the stuff of legend, right? It relieves pain, it brings down a fever, and it calms inflammation. But that last one, preventing blood clots, that's the real game changer. That's what takes it from just a simple painkiller to a genuine life-saving drug.
So how does it pull this off? Well, it's pretty brilliant, actually. It's what's called antiplatelet therapy. What it does is it goes in and permanently, and that's the key word, permanently, shuts down an enzyme in our blood platelets. Without that enzyme working, the platelets just can't get all sticky and clump up to form those dangerous clots that can block blood flow to your heart or your brain.
And because it's so powerful at doing this is why you hear about doctors recommending a daily low-dose aspirin. We're talking just 75 to 81 milligrams for people who've already had a heart attack or stroke or have a history of heart disease. For these folks, it's an absolute proven lifesaver. All right, but now we've got to flip that coin over. Because for every amazing benefit, there's a potential risk we need to be aware of. So let's get into part two, the hidden dangers. This is the side of aspirin that people don't talk about nearly as much, but it's just as important. So first up, something you might not even think about, aspirin poisoning. And it's tricky because it can happen in a couple of really different ways. There's acute poisoning, which is what you'd expect. It happens fast from one big overdose, and you get symptoms like nausea right away. But then there's gradual poisoning, which can sneak up on you over weeks from taking doses that are just a little too high, causing these subtle symptoms like drowsiness or confusion. And to really get a sense of just how potent the core ingredient in aspirin can be, look at this, just 1 single teaspoon. Now, that 1 teaspoon is oil of wintergreen, which is a super concentrated form of salicylate. That's aspirin's active compound. And 1 little teaspoon of that stuff has the same amount of salicylate as, get this, about 22 full-strength adult aspirin tablets. Just think about that for a second. That tiny amount could be fatal for a small child. It's a crazy reminder of how powerful this compound really is. And that brings us to maybe one of the most important warnings in this whole thing, especially if you're a parent. You should never use aspirin to treat a virus like the flu or chickenpox in kids or teenagers. And the reason is this terrifying link to a condition called Reye's syndrome. Reye's syndrome is pretty rare, thankfully, but it is absolutely devastating. It causes this severe swelling in the liver and, even more critically, in the brain. If it's not caught right away, it can lead to permanent brain damage or even be fatal. And that right there is exactly why you'll see acetaminophen or ibuprofen in kids' medicine today, not aspirin. So this is why you have got to know what you're looking for on a medicine label. Because here's the thing, it's not always going to say aspirin in big letters. You might see it listed as acetylsalicylic acid or just salicate. Knowing these other names is really key to making sure you avoid it when you need to. Okay, so what about for adults who are taking it every day for prevention? Well, that opens up a whole different can of worms. And that brings us to part 3, the risks of daily use. This quote, this really hits the nail on the head. Long-term use of even a low-dose aspirin can literally double your risk of having a major bleeding event, usually in your stomach or upper GI tract. See, the very thing that makes it great at stopping clots, well, that same thing makes it harder for your body to stop bleeding when you need it to. So what should you be looking out for? It is absolutely vital to know the warning signs of internal bleeding. I mean, some of these are straight-up emergencies, like stools that are black and tarry, or vomit that looks like coffee grounds. But even things like more frequent nosebleeds or bruising more easily are worth talking to your doctor about. And here's another sneaky danger you might not think about: drug interactions. Lots of people take a daily aspirin for their heart, but then they'll also take ibuprofen for aches and pains. The problem is they can cancel each other out. Let's use an analogy. Think of it like a special keyhole on your platelets. Aspirin needs to get its key in that lock and turn it permanently. But ibuprofen uses the exact same keyhole, and if it gets there first, it just blocks the hole temporarily, preventing aspirin from getting in and doing its life-saving job.
The good news is the FDA has given us some really clear instructions on this. It's all about timing. To make sure your aspirin can do its thing, you need to take your ibuprofen either at least 30 minutes after your aspirin or a full 8 hours before it. That just gives the aspirin a clear runway. Okay, so we've got the lifesaver on one side and all these hidden dangers on the other. What do we do with all this? How do we make sense of it? Well, that brings us to our final section. Part 4, the verdict.
Well, the verdict here isn't a simple thumbs up or thumbs down. It's a conversation, a really important one that you need to have with your doctor. Together, you're going to go through all of this stuff: your personal and family medical history, all the other medicines and supplements you're taking, any other health issues like high blood pressure or ulcers, and then you weigh it all. Do the potential benefits outweigh the very real risks for you?
And really, if you take one thing away from all this, let it be this. The whole point here isn't to tell you never take aspirin or everyone should take aspirin. It's to show you that this is a powerful drug, and the decision to use it every day for prevention has to be an informed one, made with a professional you trust.
And I want to leave you with this last thought, a really powerful quote from the FDA. The directions on a regular bottle of aspirin, those are for aches and fevers. They don't tell you anything about long-term prevention. For that, you just can't replace the knowledge of a health professional. So is daily aspirin right for you? That's not a question you can Google. It's a conversation you need to have with your doctor.